5-year male with pallor and splenomegaly with history of blood transfusion. Peripheral picture dewa ache. What is this? What is this? Are those thalassemia na ei cells gulo ki? Ha, always say that. These are target cells. What are these? Teardrop cells. So, what is the diagnosis? Thalassemia major. Don't say thalassemia. Thalassemia major, because there is history of blood transfusion. Mention 2 points in favor of your diagnosis. One is microcytic hypochromic RBC, teardrop cells and target cells. Okay. What is the cause for splenomegaly in this case? Intramedullary RBC destruction and extramedullary hemopiosis. Okay. Splenomegaly কেন হবে? RBC destruction হবে কোথায়? Spleen এ আর hemopiosis হবে. So the spleen will be working more. That is why you have splenomegaly. You know this. I'm not discussing too much. You just see the questions, see the case. This is what you have to study. You may not necessarily get the same questions. You may not necessarily get the same questions because এটা যদি viva দেওয়া থাকে, if this is given for viva, say I'm the examiner and I get this case, আমি এই কোয়েশ্চেনটা নাও জিজ্ঞেস করতে পারি. I can ask you something else. Hemoglobin electrophoresis, of what pattern you're going to get. For example, what pattern you're going to get in hemoglobin electrophoresis. আমি সেটাও কোয়েশ্চেন করতে পারি. I can ask you about why these patients can have diabetes mellitus. Why a thalassemia major patient can develop diabetes mellitus. আমি অন্য কোয়েশ্চেনও করতে পারি. So basically এই কেসটা দেখানোর ইম্পর্টেন্স এই যে, so you should read in and out about thalassemia. Okay, so এই চারটে কোয়েশ্চেনই যদি পড়ো, you're not going to learn anything. So basically there is a case from thalassemia. So thalassemia major can be your long question. It can come as a short marks question, short answers. Any damn questions can be framed from thalassemia major, and you must know in and out of thalassemia. So এইটাই হচ্ছে thalassemia major দেওয়ার importance. Okay, mention the iron status in this patient. কি হবে? There will be iron overload. কেন? Because of repeated blood transfusion and also negative regulation of hepcidin. Okay, and mention, two other conditions with similar morphological patterns. Two other conditions with similar morphological patterns of anemia. মানে microcytic hypochromic anemia আর কোথায় কোথায় পাওয়া যায়? Iron deficiency anemia, sideroblastic anemia, anemia of chronic diseases. Okay, so this is what you should know. But abar bolchi, I'm again reminding you, don't study only these questions. The importance of showing you this particular case is that thalassemia major, any damn questions can come from thalassemia major. So you should know in and out of thalassemia. Okay, very important from exam point of view. Okay, if you want, you can write down the answers. Okay, next case. What is this? Why? 2-year male with history of growth retardation and painful bone swelling. Serum bilirubin is raised, peripheral blood picture is given. So what are these cells? Sickle cells, kaster moto. Okay, so what is the diagnosis and mention in 1 point in its favor? Sickle cell anemia, and because of those irreversibly sickle cells. If this patient develops bone tenderness, what is the probable cause? What is the probable cause of bone tenderness in this patient? Yes, crisis. কি করে হতে পারে? কি করে হতে পারে? Vaso-occlusive crisis. Irreversible. And because of infarction, the infarction will be manifested as pain and tenderness. Okay. What is the basic genetic defect in this case? Substitution of valine for glutamic acid at position 6 of beta polypeptide chain. এগুলো বইয়ের মধ্যে দেওয়া আছে। ওকে, তারপরে এটা কি? আচ্ছা, what are the various other? Mention one test to confirm the characteristic hemoglobin found here. অনেকগুলোই দিয়েছি আমি। High performance liquid chromatography, HPLC, high performance liquid chromatography, followed by hemoglobin electrophoresis. Okay, and sorry, mentioned two other complications. একটা তো bone pain হয়ে গেল, এছাড়া অনেক complications হয়। acute chest syndrome হতে পারে যদি blood flow to the chest is cut off. So it will be manifested as dyspnea, cough, pleuritis and hemoptysis, and splenic sequestration হলো কি হবে? Autosplenectomy. Autosplenectomy ki initially there will be splenomegaly, but with passage of time, because of infarction, because of vaso-occlusive crisis, blood won't flow to spleen, and after a point of time the spleen will be converted into a nubbin of soft fibrous tissue, shrink kore jabe. That is called autosplenectomy. You should know this. Tale thalassemia, sickle cell anemia must be known to you. Thalassemia and sickle cell anemia দুটো তোমরা পড়তেই হবে তোমাদের, correct? তাহলে কি ইম্পর্টেন্ট হইলো? Thalassemia, sickle cell anemia, এই দুটো কিন্তু ইম্পর্টেন্ট। এছাড়া আরো আছে। Case 3, 55-year female with history of tingling and numbness of lower limbs. কালকে ক্লাসে positively come, Shomu sir will discuss all the tidbits of practicals. In and out of practicals will be discussed tomorrow. So please make sure not to miss the 9 o'clock class, okay? 55 female with history of tingling and numbness of the lower limbs. What is this particular cell? এই সেলটার নাম কি? হ্যাঁ, what is this cell? কোথা থেকে দেখলি? কোথা থেকে দেখলি অ্যানসারটা? নেই, আচ্ছা ঠিক আছে, ও পাশের মোবাইলেও দেখা যায়। আচ্ছা ঠিক আছে, এমনি বললাম। হাইপার সেগমেন্টেড নিউট্রোফিলস। নর্মাল নিউট্রোফিলসে কটা থাকে? 5টা থেকে 7টা লোব, 3 থেকে 4টে লোব থাকে, খুব বেশি হলে 5টা। So when do we call hypersegmented? More than 5 lobes in more than 5% neutrophils, we call it hypersegmented. এখানে কটা আছে? 1টা, 2টো, 3টে, 4টে, 5টা, 6টা, 7টা, 8টা প্রায় আছে। 7 to 8 lobes. So this is a hypersegmented neutrophils, and you should demonstrate this hypersegmentation, that is more than 5 lobes in at least or more than 5% of all the neutrophils present in the blood. Only then we can call it a case of megaloblastic anemia. So megaloblastic anemia or vitamin B12 deficiency anemia or folate deficiency anemia. So this is not the only criteria. সবথেকে আমরা দেখি, সবথেকে আগে আমরা দেখি indices. So what will happen to the indices? Just suppose examiner asks you, what are the red cell indices? MCV, MCH, MCHC. So what will happen to your MCV? MCV will be raised. So that is, this is a case of macrocytic anemia. This is a case of macrocytic hypochromic anemia. Macrocytic means there will be increase in size. What are these particular cells called? Macrovelocytes. Come in. Macrovelocytes. So what is the diagnosis? Your diagnosis is megaloblastic anemia, either due to deficiency of vitamin B12 or due to deficiency of folate. Okay. Next question. What morphological change occurs in RBC? What morphological change? RBC becomes large and oval. Large and oval, এটা হবেই, that is called oval macrocytosis, and normochromic. So macrocytic normochromic anemia. In addition, in severe cases, there is marked anisopoikilocytosis along with basophilic stippling, Howell-Jolly bodies, and Cabot ring. এগুলো আছে, এগুলো I'm not getting into the details of this. Probably this has already been done, so I'm not spending time on all these things. But you should know. So macrovelocytes is important. Other than macrovelocytes, in case of extreme severity, you can get other features too, and those features are anisopoikilocytosis with basophilic stippling, Howell-Jolly bodies, and Cabot's ring. Why gastrectomy patients are prone to develop it? Intrinsic factor. Because of lack of intrinsic factor. Okay, and mention the name of the cell pointed in the top square. Hypersegmented neutrophil, discuss করে ফেলেছি। Okay. Number 4, 22 female with history of weakness and dysphagia. Hemoglobin 6 gram, PCV 17.8, peripheral blood findings and bone marrow are given. So what is this case? আয়রন ডেফিসিয়েন্সি অ্যানিমিয়া। তো আয়রন ডেফিসিয়েন্সি অ্যানিমিয়া তাহলে আমি হঠাৎ ডিসফেজিয়া দিলাম কেন? আয়রন ডেফিসিয়েন্সি অ্যানিমিয়া, why dysphagia? হ্যাঁ, প্লামার-ভিনসন সিনড্রোম। প্লামার-ভিনসন সিনড্রোম নাম শুনেছো? স্টাডি অ্যাবাউট ইট। আই এম নট গেটিং ইনটু দ্য ডিটেইলস, তাহলে অন্যগুলো শেষ হবে না। এগুলো আশা করি হয়ে গেছে, দিস আর ওভার আই থিঙ্ক। Plummer-Vinson syndrome. Okay, very good answer. So this is a case of iron deficiency anemia. Hey, দেখো, this is a typical picture where you demonstrate what? Anisopoikilocytosis. Anisopoikilocytosis means what? Change in size as well as change in shape. যখন এই পয়কিলো কথাটা আসছে না, মনে রাখবে P for পয়কিলো, P for shape. Shape, P, shape P টা. So anisocytosis means change in size. Microcytic, macrocytic, normocytic, these are various sizes. But when the shape changes, মানে pencil shaped cells, teardrop cells, target cells, these are known as, that particular thing is known as poikilocytosis. So anisopoikilocytosis means change in shape as well, change in size as well as change in shape. Okay, so what is the, mention 2 points in favor of your diagnosis. So this is a case of iron deficiency anemia and a particular reasons go. Anisopoikilocytosis with microcytic hypochromic RBC, presence of pencil shaped cells. These are all the pencil shaped cells, right? Next question, which sex is more commonly affected and why? Not necessary that you will be getting the same question. এটা just তোমাদের এখানে দেখানোর জন্য। if I am the examiner, I can ask you, I can give you this particular slide and ask different questions based on iron deficiency anemia. Mind it. এই question নাও পেতে পারো, আমি তো আবার বলে দিচ্ছি। This is a prototype. এই টাইপের questions জিজ্ঞেস করা হয়। So this means that you should know about iron deficiency anemia, megaloblastic anemia also. So which sex is more affected and why? Women, females, why? Because of excessive blood loss. Because of menstrual flow, sometimes increased demands hote pare. Because of what? Pregnancy, lactation, etc., etc. Increased loss hote pare, increased demands er jonno hote pare. So don't say straight away to come to pregnancy, lactation, or not like that. One is increased loss. Increased losses because of menstrual blood flow, physiological phenomenon. Then increased demand. Increased demand কখন হতে পারে? Pregnancy তে হতে পারে, lactation এ হতে পারে, there is increased demand. This is the reason why women tend to develop more iron deficiency anemia as compared to men. Okay. Mention 2 biochemical markers to confirm the diagnosis. অনেক আছে। Serum ferritin. Okay, ferritin will be low. যদি serum ferritin low হয়, serum iron will be low. Serum iron low হলে কি হবে? TIBC. তো হ্যাঁ, increased হবে. Total iron binding capacity will be increased and transferrin saturation. এগুলো কিন্তু তোমাদের মাথায় রাখতে হবে, okay? Mention 2 other conditions with microcytic hypochromic blood morphology. You know, thalassemia, তো iron deficiency তো হয়ে গেল, ঠিক? Thalassemia তে এটা পড়ানো হয়েছিল, iron deficiency anemia তো এটা, thalassemia, anemia of chronic diseases, and sideroblastic anemia. Clear? Okay. Case 5, what is this? The following histological pictures are from a female aged 25 years and she is suffering from weight loss and cervical lymphadenopathy. Tubercular lymphadenitis. Simple. Why do you say tubercular? What is this? What is this? Caseating necrosis. What are these cells? Classical picture. You know, internet থেকে করেছি, so classical pictures. What giant cells? Langerhans giant cell. Langerhans giant cell. Okay. Mention the type of death in this case. What type of death? Oh, don't say necrosis. Caseous necrosis. Caseous necrosis. Mention the names of 2 other diseases with similar histopathological picture. So tuberculosis ছাড়াও কিন্তু caseous necrosis পাওয়া যায়. Fungal infections, histoplasmosis, coccidiomycosis, blastomycosis, etc. Syphilis টা আমি ভুল দিয়েছি, syphilis টা হবে না, don't take syphilis, syphilis is wrong. Syphilis এ কি causating granuloma হয় ঠিক খেয়াল হচ্ছে না, but remember histoplasmosis, blastomycosis, histoplasmosis, blastomycosis, remember this two. Okay, so this is simple, you shouldn't be missing it. Okay, case 7, what is this? Apoptosis, you don't need this now. Case 8 lagbe na, case 9 right now not required. What is this? ALL, Acute Lymphoblastic Leukemia, 5-year female suffering from fever, anemia, bone pain and generalized lymphadenopathy. Peripheral picture is given, so what is your diagnosis? What will be the bone marrow picture? Hypercellular bone marrow with proliferation of leukemic blasts. Normal hematopoietic elements are reduced. Normal hematopoietic elements are reduced. Okay. What are the various, which markers are positive in flow cytometry? Which markers? এগুলো কিন্তু জানতে হবে, একটুখানি নামগুলো জানতে হবে, কারণ এই মার্কার্স গুলো কিন্তু পিজি এক্সামে at least they will ask you. So please study a little about the markers. Just নামগুলো. CD19, CD20, CD19, CD22, CD10 and CD79A. Mind it, these are the markers. And which special stains can be used for to demonstrate the abnormal cells? PAS, what is PAS? Para-iodic acid Schiff and acid phosphatase. Para-iodic acid Schiff and acid phosphatase. So remember that, remember this, female 5 suffering from fever, anemia, bone pain, generalized lymphadenopathy, peripheral picture. So this is a case of acute lymphoblastic leukemia. Study about acute lympho. Key question dichi is not important. Key question dichi is not important. What are the prognostic factors of ALL? Very important. How to differentiate ALL from AML? FAB classification of ALL and FAB classification of AML are important. So key question dichi, just these are prototypes. Again, I'm telling you, these are just prototypes. Study about acute lymphoblastic leukemia. তোমাদের সিনিয়র ব্যাচের কিন্তু ALL মেইন কোশ্চেন ছিল এবার, তোমাদের সিনিয়র ব্যাচের কিন্তু ALL মেইন কোশ্চেন ছিল, মাইন্ড ইট, 15 marks. So don't ignore, study about ALL. What is this? An elderly female suffering from moderate anemia, weakness, fatigability and dragging sensation in the abdomen. Why dragging sensation in the abdomen? CML এর জন্য dragging sensation হচ্ছে splenomegaly. So this is diagnosis CML, but কেন হচ্ছে splenomegaly? কেন হচ্ছে dragging? Because of increased size of the spleen. Okay. Total leukocyte count, TLCs, total leukocyte count is 1 lakh per cubic meter. ঘুম পাচ্ছে? Total leukocyte count is 1 lakh per cubic millimeter. What is that? জলদি একটু, ঠিক আছে? Total leukocyte count. What is the diagnosis? CML. Cause for dragging sensation? বলে দিলাম. What are the various phases of the disease? Chronic phase, accelerated phase and blast phase or blast crisis. You know it. What will be the NAP score? NAP score increase or decrease? Cano. What is NAP? Neutrophil alkaline phosphatase is an enzyme which is present in normal neutrophils. Mone rakhbe, what is the difference between leukemia, very important, and leukemioid reaction? Difference ta ki? So what is leukemia and what is a leukemioid reaction? Leukemia ki and leukemioid reaction ki? Jodi ek kotha describe korte hoy, what is a leukemia and what is a leukemioid reaction? Mention just one word to describe it. Just one word. 2 words. One word for leukemia, one word for leukemioid reaction. What is leukemia? দেখে কেন? দেখে অ্যান্সার করছে, হ্যাঁ? তুই পাবি না, ওইখানে পাবি না, ওটা আমার হেড বলেছিল, দেওয়া নেই 100%। কোন বই দেখি, বইটার নামটা দেখি, বইটার নামটা দেখি না, আরে বাবা নামটা দেখতে প্রবলেম দেখি। ও বাবা, দেখ এগুলো পরে পরীক্ষা দিতে আসিস না। লিউকেময়েড রিঅ্যাকশন মেইন বই পড়বি। লিউকেময়েড রিঅ্যাকশনে লিউকেমিয়া, হাউ ডু ডিসক্রাইব ইট? একটা আরেকটা, হ্যাঁ, তো হাউ ডু ডিসক্রাইব ইট? One word, leukemia is neoplastic, whereas leukemoid reaction is reactive. Mind it, leukemia is neoplastic, leukemoid reaction is, yeah, I know it's not neoplastic, but a better word to describe it is reactive. That a 7-year-old female with fever, pallor and multiple petechiae all over the body. Physical examination, multiple enlarged cervical lymph nodes along with hepatosplenomegaly. হ্যাঁ, আমার কেসের সঙ্গে তো ডিফারেন্ট এটা। Multiple petechiae, why? Yes, thrombocytopenia. Petechiae কেন হবে? What are petechiae? Small hemorrhagic spots on the skin. কেন? So you should know this. কেন হয়? কি হবে? বল। Platelet count কমে যাবে. So what does that indicate? The blast, why thrombocytopenia? So what has it done? Blast cell বেড়ে গেছে তো কি হয়েছে? The blast cells have replaced the normal hematopoietic elements in the bone marrow, and that is the reason why patient can develop anything. Patient can develop symptoms to anemia, like weakness হতে পারে. Patient can develop symptoms related to neutropenia, for example, infections. And patient in this case, historyটা দিয়েছে petechiae, মানে thrombocytopenia. অনেক কিছু presenting symptoms. So don't by heart it, understand and then come to a conclusion. কেন হতে পারে anemia, features related to anemia বা features related to neutropenia বা thrombocytopenia? Because the blast cells, the leukemic blast cells will replace the normal hematopoietic elements from the bone marrow. Maturation হচ্ছে না. And because of this, there will be features, no normal RBC, WBC or platelets will be produced. And this is the reason why you can have this. Okay, acha arekta second question ache. You can also get this question. The USG of abdomen in a 50-year-old heavy chronic alcoholic reveals a shrunken nodular liver. Question দেখেছিস তোরা সিনিয়রদের? দেখিসনি? হ্যাঁ? Alcoholic liver cirrhosis. Okay. A 60-year-old male presented with weight loss, persistent pain in abdomen, dyspepsia and hematemesis. Endoscopic biopsy shows a heterogeneous ulcerative lesion in the pyloric part of the stomach. So, what is your provisional diagnosis? Describe the classification of this disease on the basis of histopathological features and describe the laboratory investigation. এই ক্লাসটা আমি নিয়েছিলাম। Gastric carcinoma. দেখ, laboratory investigations to confirm the diagnosis এর জন্য 8 marks. 8 marks. Describe the classification of the disease on the basis of histopathological features. মানে কি? এই ক্লাসটা আমি নিয়েছিলাম। Diffuse and at an intestinal type, at a diffuse type. Diffuse type মানে E-cadherin loss. আর intestinal type মানে হচ্ছে like adenocarcinoma in tubular or papillary acinar or papillary configuration যেটা। Lauren classification. So you should know Lauren classification. Okay. বারবার এর জন্য বলি, lab investigations are very important. Such a case. Prognostic factors. সবটা যদি না দেয় তো আলাদা, that's okay. ঠিক আছে? See, plasma cell dyscrasias. 5 marks এসছে, very bad question. Plasma cell dyscrasia is not only multiple myeloma, but ওখানে Waldenström macroglobulinemia আছে, আর অনেক কিছু আছে। 5 marks তুমি কি লিখবে? Maximum you can write the names. So that's a bad question. 5 marks এর জন্য it's a very bad question, and plasma cell dyscrasia is a postgraduate level question. ঠিক আছে? So go through these papers. Go through these papers. Very important. Go through these papers. Okay. So this is over. 60 male suffering from anemia and symmetrically enlarged discrete non-tender palpable lymph nodes. Peripheral blood picture dewa ache. So what is this? This is a case of CLL, chronic lymphocytic leukemia. Just know the name. Study about CLL. Okay. Sorry, diagnosis CLL. Why 10 to 15% of these patients develop hemolytic anemia? 10 to 15% of these patients can develop hemolytic anemia. Why? Because of production of autoantibodies by neoplastic B cells. একটু tough তোমাদের জন্য এটা. What aggressive tumor may develop in these patients? Which aggressive tumor may develop in these patients? This one, pro-lymphocytic transformation to diffuse large B cell lymphoma. So basically, a diffuse large B cell lymphoma, which is non-Hodgkin's lymphoma basically, that can arise, the so-called Richter syndrome. And finally, which markers? CD23, CD20, CD19. So CLL you have to study. What are smudge cells? What are smudge cells? The lymphocytes are extremely fragile, and while making a smear, the cells are crushed. That is known as a smudge cell. In CLL, it is very important. Okay. An elderly woman suffering from bone pain, pathological fractures, and renal failure. Bone marrow aspirate has the following microscopic features. What is it? Multiple myeloma. Serum electrophoresis e ki paoya jabe? Presence of M band. Presence of M band due to monoclonal immunoglobulin. Okay. Skull X-ray te ki paoya jabe? Multiple punched out lesions. Multiple punched out lesions. And what will be the urinary finding? Benz-Jones proteins. Presence of Benz-Jones proteins. ঠিক আছে? Again, you should know in and out of multiple myeloma. You should know in and out of multiple myeloma. Very important. Okay? You should know in and out of multiple myeloma. কি রে গেম খেলছিস নাকি রে? তাহলে ও এটা পেলি কোথায়? তুলেছিস ছবি? What is this? What is this? কি? Thrombocytopenia কি দেখে বলছিস তুই? ITP. So what are these platelets? Giant platelets. Giant platelets. So this is a case of chronic immune or idiopathic, but এখন generally immune বলা হয়, chronic immune thrombocytopenic purpura. Chronic immune thrombocytopenic purpura. What will be the peripheral blood picture? Presence of giant platelets. Presence of giant platelets known as megathrombocytes. Presence of giant platelets or megathrombocytes. Platelet count will be decreased, but there will be giant platelets. So, 100টা প্লেটলেটের কাজ একজনই করে দিচ্ছে, giant hulk. Okay. What would be the bone marrow picture? Modestly increased number of megakaryocytes. Naturally, যদি প্লেটলেট কমে ওখানে তো প্লেটলেট বোন ম্যারোতে তো প্লেটলেটটা বাড়বে, isn't it? Some of them are immature with large non-lobulated and single nuclei. You have to know this. And which antibody is responsible? GP2B3A. GP2B3A antibodies. Okay. Basically, it's an antigen antibody reaction. কি এটা? Hodgkin lymphoma. পরীক্ষা আছে, যেগুলো পরীক্ষা আছে আমি শুধু সেগুলোই দেখাচ্ছি কিন্তু, হ্যাঁ, যেগুলো পরীক্ষায় নেই সেগুলো দেখাচ্ছি না. So this is a case of Hodgkin lymphoma. Mention the various types of Hodgkin lymphoma. You know this: nodular sclerosis, lymphocyte rich, lymphocyte depleted, mixed cellularity, etc., etc. Okay. And these are the markers: CD50, CD30, CD15, CD20. Which markers are positive for neoplastic cells? Again, markers are থেকেও কিন্তু বেশি important. You should know the basics of Hodgkin lymphoma, and you should know how the lymphocyte, how nodular sclerosis looks like, how lymphocyte rich, lymphocyte depleted or mixed cellularity looks like. এগুলো জানতে হবে. How does the RS cell looks like? What is an owl eye appearance? All these things must be known, and they must be at your fingertips. Clear? Hodgkin lymphoma কিন্তু exam point of view থেকে pretty important. 56 male suffering from fever, productive cough and chest pain. TLC high with neutrophilia. কি, what is your diagnosis? Okay, pneumonia. আগে তো নিউমোনিয়া বলো ক্লিনিক্যালি, তারপরে এক্সরে তে পাবে। What is the finding in chest X-ray? Opacity is due to consolidation. What is the commonest organism in nosocomial form of this disease? Staph aureus, pneumococcus হতে পারে, pseudomonas আসতে পারে, অনেক কিছু আসতে পারে, no problem. And what are the stages? Congestion, red hepatization, gray hepatization, and resolution. Okay, simple. এটা কি আর বলতে পারছি না। আমি অ্যাকচুয়ালি ক্লাস নেওয়া শুরু করেছি কিন্তু প্রায় 9:45 থেকে বা 9:50 থেকে, সব মোর দ্যান অলমোস্ট 35-40 মিনিটস নিচে। হ্যাঁ, হোয়াট ইজ দিস? হিস্ট্রিটা দেখো, হিস্ট্রি আর কোয়েশ্চেনের মধ্যে সবকিছু দেওয়া আছে। কোয়েশ্চেন গুলো পড়ো আর হিস্ট্রিটা দেখো আর কোয়েশ্চেন্স গুলো পড়ো। আরে লাস্ট কোয়েশ্চেনই তো, which special stain is used to diagnose the case and why causative organism give a positive color? মাইক্রোবায়োলজি কি বলছে? হ্যাঁ, don't say TB, tuberculosis. So what is the diagnosis? Pulmonary tuberculosis. What are the radiological features? Bilateral fluffy or woolly opacities of the lobe. Bilateral fluffy or woolly opacities of the lobe. কেন বলে আমি জানি না। Okay. What is the source of hemoptysis in this patient? Cavitation, erosion of blood vessels by active pulmonary lesion. কোন blood vessel হতে পারে? Bronchial artery or pulmonary artery. And last হচ্ছে Ziel-Nielsen stain. Which stain is used to demonstrate the organism? মানে Mycobacterium tuberculosis. Ziel-Nielsen stain. আর কেন হতে পারে? এটা মাইক্রোবায়োলজির কোয়েশ্চেন। কি হতে পারে? The acid fastness of the tubercle bacilli is due to mycolic acid on the cell wall, isn't it? The acid fastness কেন? Because of mycolic acid in the cell wall of the bacteria. The bacilli take up the stain by heated carbonfuscin and resist decolorization. Microbiology question, but not important. পরীক্ষায় যদি অস্পিতে রাখা হয় তাহলে you have to answer. Otherwise, exam এ কিন্তু যে কোনো question, what is primary tuberculosis, what is secondary tuberculosis, what is Pott's disease, Pott's spine, all these things must be known to you. Okay? এটা কি? Yes. Male 75 presented with weight loss, cough, chest pain and dyspnea. Contrast enhances CT scan 5.5 centimeter round, completely enhanced mass in the left lobe. So what is the diagnosis? Yes, tuberculosis. Tuberculosis কে বললো? Tuberculosis তো হয়ে গেছে। What is your diagnosis? Bronchogenic carcinoma. How do you confirm the diagnosis? আমি ক্লাস নিয়েছি, আমি আর এক্সপ্লেন করছি না, অনেক কিছু আছে। And what are the common histologic types? Non-small cell and small cell and non-small cell. Small cell is by far the most aggressive, associated with smoking, and non-small cell এর মধ্যে কি আছে? Squamous cell carcinoma, large cell carcinoma, adenocarcinoma. Adenocarcinoma, a special variant is bronchoalveolar carcinoma. Okay? লাগবে না, myocardial infarction পড়ানো হয়নি। Case 22, 39 female presented with epigastric burning or aching pain. Pain tends to occur 1 to 3 hours after meals, during the day and worse at night. Pain relieved by alkali or food. What is your diagnosis? Which one? Duodenal ulcer. Peptic ulcer, duodenal. Okay. Which organism is commonly associated with it? H. pylori. Mention 3 complications. These are the complications. Perforation of the body, bleeding from gastroduodenal artery, gastric outlet obstruction. Which means again, entire peptic ulcer disease must be at your fingertips. Peptic ulcer disease is very important. Difference between gastric ulcer, duodenal ulcer and gastric ulcer. Especially microscopic features of peptic ulcer. All those zones gulo, zone of necrosis, zone of cicatrization, etc., etc. Repair kothay hocche, all those things must be at your fingertips and you must answer them. এই তিনটে কোয়েশ্চেনই নয় কিন্তু, there's so many things that you have to study. Okay, what is this? That ভালো করে দেখ, this is ulcerative colitis. থাকে তো ulcerative colitis. Mention to histologic findings: cryptitis and crypt abscess, non-specific inflammation, non-specific acute and chronic inflammation, cryptitis and crypt abscess. What is cryptitis and what is crypt abscess? What is crypt? Bol dekhi. Yes, what is cryptitis and what is crypt abscess? এটা হচ্ছে crypta. So what is cryptitis and what is crypt abscess? These are the crypts, this is the lumen. The entire thing is the crypt. So what is cryptitis? Inflammation যখন এই level অবধি আছে, that is cryptitis within the crypts. Or when inflammation extends up to the lumen, it is called crypt abscess. Okay, so cryptitis, crypt abscess. And what are the extra intestinal manifestations? অনেক জায়গায় হয়, আমি স্কিনে হচ্ছে, আইয়ে হচ্ছে, এটসেট্রা এটসেট্রা, আমি এই দুটোই দিয়েছি। স্কিনে হচ্ছে কি এরিথিমা নোডোজম, আইয়ে হচ্ছে আইরাইটিস, ইভিআইটিস এটসেট্রা। Again, open that book, Vinay Kamal, খুব সুন্দর করে দেওয়া আছে। What is this? What is this? এই জিনিসটা কি কি বলে জিনিসটাকে? হিমোফিলিয়া কেন একটা মানুষ মরতে পারে? খুব রেয়ারলি হিউম্যানস ক্যান ডাই, মানুষ মারা যেতে পারে। কেন মারা যেতে পারে? A trivial injury can cause intracranial hemorrhage. A trivial injury can cause intracranial hemorrhage. ওই যেটা বললো intracranial hemorrhage, পা দেখে মাথা বলিস না বাবা, কিন্তু intracranial hemorrhage can, hematolosis, a patient will not die. That will cripple you, but you are not going to die. So what can be the cause of death in such patients? The cause of death in such patients will be intracranial hemorrhage. Okay, and what abnormality is observed in coagulation profile? The coagulation profile will be prolonged. Okay, APTT will be prolonged. Bleeding time, clotting time will be normal, but APTT will be prolonged. এটা আমি actually APTT লিখে দিতে হবে। Bleeding time, clotting time will be normal, but APTT will be prolonged.